Did you know that 1 in 3 people don't change their toothbrush until it's completely frayed? And 60% of the population, they don't really change their toothbrush after being sick. You can get a reinfection. Well, welcome to the Wonder Tooth podcast in this new episode. And we are talking about when you should be changing your toothbrush. Before I get going, don't forget to subscribe, like, and share with all your friends and family members to learn from me, Dr. Saad. But who am I? What am I doing here? My name is Dr. Saad. I am a cosmetic dentist practicing in the state of New Jersey. I have a dental license in the US, in Canada, and in Egypt. I've been doing dentistry for over 20 years, and I love dentistry a lot. And I also have a master's degree in implantology, in implant restoration, and implant placement. And I do a lot of cosmetic veneers, smile makeover, same day dentistry, you name it. Before we continue, make sure you put the code Dent56. It's Dent56, and this is to get a complimentary consultation in our office in Princeton, New Jersey. Let's jump in and dive into the world of toothbrushes. What's going on? When should I replace my toothbrush? Remember the 3-month rule. So the American Dental Association, they say that you should change your toothbrush every 3 months. I say, well, if it's not really cleaning, then it's time to get another one. Okay? How do you know that? How can you tell if the toothbrush is not really doing what it's supposed to do? First of all, why do we even have to change the toothbrush? Okay. When you start to brush your teeth, there is plaque and there are food debris. And these, they get entangled inside the bristles, which is really yucky. And with time and water and heat, they start to become even moldy. And you're putting that back in your mouth. And some people, they wouldn't change them until there is like a change of smell. So after you start to brush, I would probably, depending also on the type of toothbrush, I personally use a soft toothbrush like soft bristles, and I would recommend everybody to use that. Even if you feel that it's not cleaning, it is actually cleaning. You might need to replace it maybe sooner than the hard or the medium, but at least you are protecting your teeth. So the trick is really, which is a little gross, but when you put your nail on your tooth and you look, and if there is white, the white plaque after you brush, it's time to change your toothbrush. It's time to throw it and get another one. Okay, and if you buy them in bulk, you can get them really for a lot cheaper. I don't really care about what type of toothbrush it is, like which brand, this is that, manual or electric. As long as they are doing the job, that's really all that matters. And there is a big misconception that electric toothbrushes are better and they last much longer. The head. Well, I hate to break it down to you guys, but it's pretty much the same like a manual. I personally have a manual and I have an electric, and I try to kind of alternate between both of them. I try to use the electric in the morning, especially if I'm running, but I don't, when you're using it, don't put pressure on. Just let it slide over your teeth and do the job. And at night, I like to kind of be meticulous and go a little bit, more between, my teeth. And then, of course, after that, you need to floss. But really, the big thing is if you put your tongue on your teeth and you feel like it's nice and clean and, kind of soft, like clear, you know what I mean? It's good. But if you put your nail like this and you feel like there is something going on, it's time to replace the toothbrush. Now, some people, and it's actually 60% of the population, when they have a cold, a flu, or, COVID or anything, they forget about changing their toothbrush. But actually, the bacteria can stay within the bristles of the toothbrush and it can reinfect you again. Or if you have kids and or you're with your partner and you put your toothbrushes right next to each other, they can reinfect each other. So please, if you're getting a cold or a flu or anything that's, respiratory, that like aerosol based, throw that toothbrush and get a new one. Okay? I don't work with any toothbrush companies. I have no affiliation with anybody, but I just want you guys to stay healthy. So this is a big one. And kids too, you know, oh, my kids, they sleep like in different rooms. They don't see each other if one of them is sick, because I have kids too. But believe it or not, if their toothbrushes are right next to the, you know, each other in the bathroom, then there you go. Will they get sick from it? It can be contagious. Or some couples, I don't know how they do that, but 10% of the population, like couples, they use each other brush. They think it's cute. I don't think it's cute. Who thinks it's cute? You gotta tell me down here, because I've heard of that. Yeah, no, absolutely not. You have your mama, when you were little, she told you, you don't drink from anybody's cup. You don't use anybody's forks or spoon. You use your own stuff. You use your own toothbrush. You have your own hairbrush. Don't use anybody. And she was absolutely right about that. And you have to listen to your mama at this point. So please, your toothbrush is yours and it's yours alone. That's it. You don't need to use somebody else's toothbrush or it's not hygienic. And that actually reminds me of that, oh my God, I was in Vegas. Yeah, they have this very weird show. It's called the Human Fountain. I don't know if any of you watched that, but it was in Vegas and it was very weird. And I think it was on one of those Americans Got Talent. I think it was one of their shows. And then, yeah, I couldn't believe it. I mean, people were laughing. I was like, oh my God, what is this? So yeah, the water fountain or the human fountain, they were actually kind of making shape of like drinking water, making shape. I'm okay if you spit it out in the air, but they're spitting into each other's mouth. And I almost like, okay, I was like, I'm a dentist, for the love of God. Oh my God, oh my God, oh my God. Anyway, don't ever do that, okay? It's not cute, it's not cool, it's not like, don't do it like a dare or whatever. Like, it's really yucky, okay? Please, this is not hygienic at all. So make sure your toothbrush is yours and that you are, you know, using it. And once you start to feel that, you know, when you run your tongue around your teeth, that if you feel something feels rough or not completely clean, it's time to replace that toothbrush altogether. Throw it, get a new one. Okay, but why is that important? Because the big scientific thing is those bristles can actually trap some bacteria in it, because as I said, plaque can sit, you know, between the bristles. And now there are two types of bacteria that are pretty bad: E. coli and Staphylococcus mutans. And these are like some of the big ones. I don't want to get really too technical, but these are some of the big ones that live in your saliva. And the Staphylococcus is one of the most important ones this is number one bacteria that we learn in dentistry, and this is responsible for cavities. So you don't want that bacteria sitting on your toothbrush. And the E. coli, absolutely not. Nobody wants that sitting on your toothbrush. And if you start to see, you know, that the toothbrush is getting like changing of color or it smells funny, get rid of it. Time to get a new one. Also, storing your toothbrush, because now there are those nice, fancy, cute little covers. Oh, it looks cute. You know, it's much, you think it's more hygienic to cover your toothbrush. I say no. You need it to stay up in the air. Actually, you need that toothbrush to dry, because you are basically entrapping the moisture and the heat, especially if you have it in your bathroom near your shower and you're showering with hot water. And this is beautiful for you have your own little chemical lab down there, or biologic. Yeah. So basically, yeah, don't use the cover. I know sometimes, me personally, I would use it if I'm traveling, because but once I'm traveling and, you know, I use those cups, plastic cups. I don't like, you know, if I'm in a hotel or something, I don't like to use the glasses too. I don't feel comfortable. But, you know, like a plastic cup, and you put your toothbrush, you don't have to cover it. Just, you know, when you're traveling, you want to put it in your case or whatever. But that's really it. But don't use the cover every day, because you really want the toothbrush to dry. And the best place, really, if you can put it next to your window and your window is open so there is air or even some sunshine, that's even better, because it's, you know, it keeps it dry and it kind of disinfects it with the ultraviolet rays from the sun. There you go. I wouldn't get any of those fancy sanitizer or, oh, like this is, you know, like a sonic, you know, cleaner for my toothbrush. Or get a new toothbrush, guys. You can buy a whole bunch of them, like a dozen for, you know, like minimal, if you get them from like, you know, one of those big Costco, BJ's, anything, Sam's Club, anything, just replace it. And you also should teach your kids to do exactly the same thing. You know, you're not going to use somebody, you know, your brother's toothbrush because yours fell on the floor. That's really yucky. Okay, everyone, your toothbrush is yours and it's yours alone. Okay, soft, don't forget that, soft or extra soft bristles. You can alternate between manual toothbrush and an electric toothbrush. I wouldn't rely completely, totally on an electric one because sometimes, as I said, you have more control when you are using a manual one. But if you feel like fancy, okay, it's good to use this in the morning and this at night, that's fine too. And I mean, really, your toothbrush is yours. Don't think it's cute to use it with your partner, okay? I don't want to say more than that, but just remember that water human fountain thing. Yeah, and don't forget, it's really like 3 months. This is the rule of thumb, 3 months, but I would say sometimes it could be even less than that. I personally brush 3 times a day. So I have a couple of brushes at home and I have a brush at work. And after I eat lunch, I brush my teeth as well. You don't really have to use like a toothpaste. You can just use some water and you're good to go. But in the morning and at night, I like to use toothpaste and I like to use fluoridated toothpaste too. And this is a whole different episode talking about the fluoride, or should we use it or we should not use it or what. But let's keep it simple today because I don't want to get into a lot of misconception about whether to use or not to use fluoride. But I hope you learned something today. You learn when you are supposed to change your toothbrush. So when your tongue around your teeth, if you feel it's clean, you're okay, as long as it's within the 3-month interval. If it's less than that and you feel like, okay, it's not really cleaning, well, it's time to throw it, get a new one. Then time, you know, to replace it when you are sick, or if you have your partner is sick, you're putting your toothbrushes next to each other, time to replace it, get a new one as well, because you don't want to get, you know, it's contagious. It can be contagious. And also an old toothbrush, like some people, I think they can stay up to 6 months, you know, using the same toothbrush, and then they come and say, I have like, you know, that bad taste and my mouth doesn't, you know, smell good, and what's going on? And I'm like, when did you change your toothbrush? Oh, I don't remember. Do you scrape your tongue? I don't remember. Oh, by the way, too, it's very important to scrape your tongue, guys. Don't use the toothbrush to do that. That's really, so the tongue, there are little filiform. They look like tiny little, you know, the corals in the water, they look like this. And the bacteria sits in between with the plaque and also the debris. And you cannot really use the toothbrush to get in there. So you need to get the tongue scraper, which some of them are plastic, some of them are metal. And you cannot put it, and you'll be surprised of the stuff that come out of that. You would be really surprised. Don't do it in front of your partner too. Just go away and do it on your own. But you have to do that so that you can clean between the poor filiform. They need to be clean. And when you do this together with brushing, you know, and flossing, you're gonna feel so good about yourself, and you're gonna feel like, okay, you finally have a fresh breath. So an old toothbrush can lead to also halitosis or bad breath. Okay, this is an important one. An old toothbrush, because you're not really cleaning, the gum gets, you know, destroyed. Your gums basically, they start to bleed. Even if I'm brushing, but my gums are bleeding. I don't know. Well, it's an old brush here that it's not doing what it's supposed to do. So make sure you're brushing properly. And how do you brush properly? Because this is a good, important question. So you're gonna put the toothbrush on the top teeth, 45-degree angle, like this towards the gum. And then you're gonna try to kind of, you know, vibrate it gently, and then you're gonna go from top to bottom, like almost half a circle. That's how you brush your top teeth. Why is that? Because the tooth, and the gum is covering, and there is like what we call a little sulcus. So it's like a tiny little pocket, and the bacteria sometimes they sit there. So you want to basically put the toothbrush, let it just vibrate a little tiny bit to kind of clear whatever is in there, and then you go in between and you get rid of it. And then after you do that, you're gonna floss. Bottom teeth, it's the opposite way. So you put like a 45 degrees angle like towards your gum, just a tiny little bit, and then you're gonna go from half a circle from bottom to top, and after that you're gonna floss. And you can use whatever mouthwash you want to use, or warm salt water. You can use a water flosser too, but a water flosser is plus flossing too after you floss. Okay, I hope that explains when you need to change your toothbrush. Okay, a lot of misconceptions, a lot of myth, and you should not use anybody else's toothbrush at all. Okay, and I hope you learned something from this today. Make sure to subscribe, like, and share, and I will see you next time in another exciting episode. Don't forget to take care of your teeth so that they can take care of you. Until then, keep smiling with Dr. Saad.